Welcome back to CEO Money. I'm Michael Yorba.
And I'm Mervyn Price.
All right, our next segment is Dr. Alan Bierman with the Bierman Medical Group. All right, Bauman, Dr. Bauman Medical Group was founded in 1997 with a single mission to improve the appearance and well-being of its patients through optimum hair and health and hair restoration. Under its leadership, Dr. Bauman is one of only 100 physicians worldwide to earn board certification for the prestigious American and International Board of Hair Restoration Surgery. Bauman Medical delivers exceptional and consistent results and has treated over 17,000 hair loss patients while conducting more than 7,000 surgical procedures since its inception. Dr. Bauman, welcome to the show.
Well, thanks so much for having me, Michael.
My pleasure. I wanted to give just a little overview, but please, if you can bring some depth to your background and then talk to us about the procedures and the industry sector that you're in.
Sure. Well, thanks so much for that great introduction. I mean, to put it in short, simple terms, what we do is help people look good and feel great by restoring their hair. And hair loss is a problem that's encountered by 80 million Americans out there. So many women and so many men are afflicted by unwanted hair loss on their scalp and other places too. And we do our best to try to help them keep the hair they have and restore the hair they've lost. And the technology in terms of medical treatments and procedures has changed light years in just the 2 decades or more that I've been involved in the industry. So it's a pretty exciting time to be a hair transplant surgeon and a hair restoration physician.
I wanted to get into that. Tell us how your industry sector has changed and technologically where you think it's going. And then obviously Merv's going to want to ask you about all of the different procedures and treatments that you offer to your patients.
Yeah, so it's changed a lot. I mean, hair transplants were first done in the 1960s with, plug-type painful procedures that didn't really look natural, weren't all that effective, and they didn't have any medications to stop the progression of hair loss or any other therapies for that matter. Right. And today, we can use a variety of different tools to help people keep the hair they have growing strong, affecting the follicle through medications and other therapies, treatments, laser light to cell therapy, you name it. And then we can use minimally invasive hair transplant procedures to redistribute single hair follicles, one at a time if we need to, artistically into a hairline or an eyebrow area to recreate something that looks good and looks 100% normal and natural, not pluggy, not painful, quick recovery and permanent.
A simple question, what can bring on thinning hair or hair loss?
Sure. Well, there can be a lot of things that affect hair follicle function for both men and for women. I mean, mostly what we're dealing with is genetic hair loss. And so that means that you've gotten it from your parents, mom's side or dad's side. They've passed on the genes to you of hair thinning. And, you can see male pattern hair loss from across the room. It's a receding hairline, it's thinning in the crown, and it can go to complete baldness up on top if you don't stop it or restore it. But, everything from medications to lifestyle factors to stress to how well you sleep and eat and such, all of these different things, illnesses and whatnot, can affect the functioning of the hair follicles. And so, like, for example, when a patient comes in with a hair loss problem, we've got to spend quite a bit of time going through their medical history and risk factors before we even get to looking at their scalp,
I do. What about the consumers? Is there anything they can do at home to help with hair loss?
Well, you look, consumers at home, people have tried for many years using over-the-counter products like minoxidil Rogaine and things such as that, and there are consumer-grade lasers that are out there. But the problem is that without measuring what's going on at the level of their scalp, without a detailed examination process, a lot of patients are doomed to fail. And so it's a big problem out there. Many people will give up treatments that are actually working because they don't realize that it's happening. And they don't know that they're getting a benefit because they haven't given enough time. Or they haven't had someone measure or examine their hair loss situation and actually even point out some of the other risk factors that may be going on in their lives.
That brings my next question. What should they be asking you or somebody like you when they turn to a professional?
Well, when the general public needs help, they're going to turn to board-certified hair restoration physicians, and of course that's something different than we've had years ago. Not a lot of us are dermatologists. We come from all backgrounds of medicine to specialize in the field of hair restoration or hair transplant surgery. And patients contact me through the internet, through my website, through a phone or an email, and they want to know what they can do about their hair loss situation. So we'll start a long-distance consultation. They'll fill out some forms, maybe submit some photos of their situation, and I'll get on the phone with them or do a video conference and see exactly what's happening over time to their scalp, get an idea of how bad the situation is, if there are things that we can prescribe and dispense to them long distance, or if they actually need to come in for a detailed evaluation to determine if they're a candidate for different types of procedures like platelet-rich plasma or hair transplantation. There's a number of different things that can be done.
Well, at BaumanMedical.com is where they find you. But you just mentioned something, platelet. You said platelet-rich plasma. I've never heard of that. What is it?
Oh, gosh. Platelet-rich plasma is a biocellular regenerative technology that's been used in hundreds of thousands of patients. Athletes like, orthopedic surgeons will do these treatments for injured knees and joints. Bone, muscle repair can be triggered by platelets that are found in your own blood. So, years ago, many of these athletes used to get steroid injections in their injured knees and so forth. Today, they're getting platelet-rich plasma, and we can utilize that same kind of technology up on the scalp to stimulate better quality hair growth and hold off the hair loss process.
All right, eyebrow transplantation. I wanted to hear a little bit about that, because.
Well, eyebrows are the frame of the eyes, which are the windows to the soul, so to speak. So you need window frames for those. And eyebrow loss can happen with medications and also with age and heredity. And it's tough to restore eyebrows without hair transplantation. So we move some hair follicles around from the back of the scalp into the eyebrow area. It's a delicate, artistic procedure, much like the hairline work that we do, but it's a permanent restoration of hair to the eyebrow, and even eyelash transplants can be done today.
Dr. Bauman, I'm looking at your website here, and you basically cover the lot. There's topical, systemic, there's laser, there's surgical. We'll talk about some of those, but I have one question which is maybe a little odd. When I was a young man in London, there's a man called Rage Dwight playing the piano, and he had no hair, but when he changed his name to Elton John, he has a beautiful head of hair. How did that happen?
The miracles of modern medicine and hair replacement. I know that he's had, through the grapevine, I've learned that he's had some procedures in the past, but mainly he's turned to hair replacement, which would be a wig or a weave to really restore his head of hair. But, that technology has changed a lot, too. Today we use cranial prosthetic devices, hair and scalp prosthetics that are 3D printed to recreate a full head of hair for people with total and complete hair loss. So I don't know Elton John's situation, but, if he's looking for a complete restoration of a beautiful head of hair, he should go to my website and give me a call.
How do you decide whether someone, needs a topical or a systemic condition? It must be very complicated. Do you have to study the cellular structure of the follicle and the scalp?
Well, look, it's not necessarily that complicated, but it does require a detailed investigation of what's going on with that patient. Is it a male or female? What areas of concern do they have? What exactly is going on in the area where they feel the thinning is happening? And when we look at the scalp, is it a problem of hair quality, hair caliber? Is it a problem where hair follicles are just missing, not growing? Is there some degree of inflammation or other activity at the level of the scalp that's preventing hair loss? There's a number of different things that go on during a consultation process to determine what is the most appropriate course of action, what's going to help that patient get the best results. The scalp is very much like a garden. If you're throwing down some fertilizer and there are no plants in the garden, you're not going to get much regrowth there. Right. So you may need to move some plants around and redistribute them, so to speak, if you're severely depleted of hair. And that's where hair transplants come in.
We have about a minute and a half left. Formula 82F, briefly, can you tell me what that is?
Well, the 82 formulas, they started with minoxidil, looking for a product that was better than Rogaine, because Rogaine is over-the-counter, greasy and gooey, nasty and messy, and not all that strong. And clever compounders have figured out how to make 82M, which is a compounded version of minoxidil, less greasy, less gooey, and more palatable to the scalp and stronger on the hair follicle. So we've prescribed that kind of minoxidil or Rogaine alternative to literally thousands and thousands of patients over more than 15 years. And it's the most powerful hair growth topical treatment I've seen. It is a prescription item, so you do need a prescription for that. And the 82F version is relatively new. That contains topical finasteride.
Dr. Bauman,
yeah.
we've got to end it there, but you've been a great guest on our show. I want to thank you for your time and coming onto the show.
Well, thanks so much for having me. I really appreciate you taking the time having me on today.
My pleasure. Dr. Alan Bauman, Bauman Medical. BaumanMedical.com is where you can find him. All right, you've been listening to CEO Money with Michael Yorba.
And Mervyn Price.
Thank you so much. And all of the shows you've heard today, as every day, are archived on our website, WFN1.com. Thank you.
Thank you for listening to CEO Money. If you would like to be a guest on our show or know someone who should be on our show, please contact us at info@WFN1.com or our website, WFN1.com. If you would like to reach any of our guests, please visit us at WFN1.com. Join us on Twitter at WFN Live or our Facebook page at WFN Live. We will be back tomorrow with more great interviews and ahead-of-the-curve information you just can't get anywhere else.
CEO Money is sponsored by WF News 1 Incorporated. Views and opinions heard on CEO Money are not necessarily the opinion of this station or its management. Material on this program is intended for general information only and should not be taken as specific investment, tax, or legal advice.